Over 90% of the time, cases of carpal tunnel syndrome have no known cause. The rest are attributed to trauma, rheumatoid arthritis, or other conditions that cause swelling. Dr. David Duffner of Desert Regional Medical Center in Palm Springs discusses the surgery that helps alleviate the pain.
Carpal tunnel syndrome is a pinched nerve in the wrist. The carpal tunnel refers to an anatomical structure in the wrist where the tendons and the nerves go from the forearm to the hand. There's two bones here in the wrist that are connected by a ligament, and the tunnel is under the ligament where it goes between the two bones. So between the bones and the ligament there's a tunnel where all the tendons from the forearm that move the fingers like this go through that tunnel. There's a nerve in there also, and the nerve is the softest thing in the tunnel. So when there's any swelling of any of the structures in the tunnel, the nerve gets pinched. Conservative treatment is designed to reduce the swelling, and that can be just as simple as activity restrictions or wearing a brace, or sometimes medications such as anti-inflammatory medication, aspirin, Tylenol, that sort of thing. And then holding the wrist in a neutral position instead of extended or flexed can help relieve the pressure in the carpal tunnel. Many people get symptoms at night. It wakes them up at night and it feels like the hand is asleep. That's the common description that people have. It's like my hand's going to sleep. But it's really nerve pain, and it can feel hot, cold, numb, tingly, a lot of different sensations because it's nerve impulses that your brain is receiving that really don't make sense because the nerve's not functioning well. So the treatment is designed to relieve pressure on the nerve. If the non-operative treatment doesn't work, then we have an operation that's minimally invasive to go in and release that little tunnel. Think of it as undoing a zipper. And by releasing that ligament, it allows the ligament to spread, and when it spreads, it takes pressure off the nerve. The surgery to relieve carpal tunnel syndrome is called a carpal tunnel release. Now, the traditional method is a longitudinal scar down the palmar crease, and that method works very well. But there are newer methods that are minimally invasive, and with that technique, we make a small incision here and put a little device inside the hand, and attached to that device is an endoscopy, which is a scope, basically, and we can actually look on a TV monitor and see inside the hand. And once we establish the anatomy and see where the problem is, then it's easy to raise a little scalpel, a little knife on the inside, a very tiny knife, and divide that ligament, just like undoing a zipper. And so it can all be done percutaneously with 1 or 2 stitches to close the incision, and this allows for faster recovery. Of those that require surgery, the success rate is very high. It's probably one of the most satisfying operations that we have because the patients do so well. Now, I don't want to call it minor surgery because, as one of my professors told me, the definition of minor surgery is surgery on somebody else. But generally speaking, the recovery is fairly quick and fairly simple compared to many of the other operations we do. In fact, I wish all operations worked as good as this one does.